Welcome back. It's Dr. Jennifer Boney, Doctor of Physical Therapy, better known as DocJenFit, owner and founder of Gen Health, your own platform for all aches and pains or just needing a routine to follow to feel better in your body. And today we're going to do a little hip opener. Now, this is kind of like pregnancy prep. So especially at the end of pregnancy in third trimester, this is a great one to come back to. However, you can always start it in second trimester as well. It's just going to feel good to start to open up those hips along with the laxity that they're already getting from the hormone. But this is going to help to feel a little bit better into those hips, hopefully. Now you can I'm going to have a block here. As long as you have like a block or a small pillow, something. And if you know that you're super restricted in your hips, you could also have, like a stack of pillows or a long blanket or something to sit on to help elevate your bottom, especially for this first one. Okay. So if you know that you're restricted, like sitting cross-legged is like a no-go, go grab that right now and then come back and we're going to get right into it. So we're going to go into a hip 90-90 position. So that means you start with your legs kind of right out at 90 degrees and we're just going to shift them over. Now, what I want you to see is 90 degrees in your front leg and 90 degrees between your legs and 90 degrees in your back leg. Okay. So adjust as you need to. You want to find those 90-degree angles here. Okay. As best as you can. We're really focusing on what's happening at the hips, not what's happening at the knee, which is why we want a little bit more space at the knee. Okay. Now from here, I'm going to do a QL stretch. Hopefully it's going to feel really yummy. So I'm going to push with my inside hand on this front knee and I'm going to reach over and get that side body stretch. Take a breath in. Lean into this front knee just a tiny bit. And then we're going to shift over to the other side. So we shift. So this is where you could be elevated. You don't have to be flat on the floor like I am. I've done this one a lot. So again, check 90, 90, 90. Take that inside hand, press it onto that knee and reach it over. Take a breath into that side. And then again, lean into that front knee just to open up that booty a little bit. Keep that back flat. And then we're going to shift and move it over. You can use your hands as needed for this. Okay. So take that inside arm, reach it over, take a breath in, relax, and then bend, reach over that knee with a flat back till you feel a good booty stretch. And then lift and go over to the other side. Inside arm, reach, take a breath into that side. Lean over with a flat back. And we'll just do one more on each side. Okay. You can always do a couple more, especially if you're like, this is feeling really good. And like my body has been missing this movement my whole life. You can always spend a bit more time here doing this one. So you don't have to move through it quite as quickly as I am. I'm just not wanting to waste all of your time today or hopefully not waste because this should feel really yummy in your body. Breath into your side, reach over that knee. And then rotate and coming out. Now we're going to go a little bit more active. Okay. So now it's okay to have those feet a little bit closer together. Okay. I'll start this way. So now feet are going to be a little closer so we can get up and over our legs. And I'm going to show you how you go to one side. And now you're going to try to go up and over. This back leg is going to come in front as a lunge. So I'm going to lean over my shin. You can use your hands if you need to. Lean over my shin, come up into a lunge. My inside or my front hand, same as that leg, is going to swipe in. I tuck my bottom and I just kind of reach up and over. This is going to give me a good hip flexor stretch on the opposite side. Then I'm going to bring that leg back. Sit into it, rotate out. And again, I'm going to shift onto this leg. This front leg comes in, front arm, reach up to the sky and reach over for a good little hip flexor stretch. Keep that pelvis kind of tucked under here. Okay. Now we'll go a little bit faster. So coming back and you see how I have some support. So you can have support around you if you need to. Use your hands as needed, as warranted. We're getting a little bit more active, but again, you can use your arms for support. Tuck that tailbone, reach up and over that front leg, and then come on back. Switch it around. Lean up and over. Breathe so that psoas can get really tight. Sometimes we start to feel that round ligament pain, right? So keeping those hips nice and open is such a good idea. We just have one more on each side. Breathing. So really take a breath into that hip that's opening up. That's how we start to get into that psoas as well, as using that diaphragm, since there's such a connection from that diaphragm all the way down to that psoas area. So hopefully you started to feel that. I know that one's a little difficult. Take it at your own pace. Take it at your own time. But I'm telling you, getting that active movement in those hips is going to be so good for you. Okay. Now we're going to do an offset cat-cow. So we're going to kind of shift how our hips are doing. So that's why I have a block, or like maybe a little bit more firmer of a pillow, or a stack of blankets, stack of towels. So you can be creative here. Okay. Place it under one knee, and we're going to let that other knee shift completely down. So now I'm shifted in my pelvis. I'm not necessarily leaning one way or another. I'm trying to go straight down. So straight from a quadruped position, straight down. And now I'm going to do some cat-cows. Okay. So I'm going to open, breathe in, breathe out, and round. Breathe in. And we'll do just 3 times on each knee. Breathing in. You can always, again, spend a little bit more time here. Okay. So this is helping to open up that back of the pelvis in a different way by utilizing the entire spine to help out. So again, from that full quadruped position, I'm going to drop my knee straight down and then do an arch, open, round, open, round, open. Spend a little bit more time here, and round if you feel like you need it. Now I'm going to take that block, put it on the between my knees, and now I'm going to rock back, but I'm going to try not to round my back. So you want to try to keep your pelvis like completely flat and straight. It's almost going to feel like you're arching up to the ceiling. As I rock back, I'm going to open my legs into internal rotation, opening up that space. Breath in, open, breath out as you come forward. Feet apart, breathe in, breathe out. So we're opening the pelvis in a different way, which is so needed, especially as the last part of labor where the baby's coming out. This helps to move those sit bones away from each other, and having access to it prior to going into the birth is going to be so key here and essential. So we just do about 5 and open. Okay. Last thing, we're going to end in a little squat. And so you can have the block here if you need to, if you want to sit on the block and have support into that low squat and just kind of open. Think about, as you breathe in, you're opening and expanding from that pelvic floor. As you breathe out, you're just relaxing the body, opening those knees, opening those feet. If you can tolerate it, try it without the block. Okay. Open those knees, flatten out that back, opening that pelvis each breath, and try at least 5 to 10 breaths here. The more that you can get comfortable into that low squat, the more we help to relax the pelvic floor, open up those hips, and start to make room in that whole hip area, and hopefully help to reduce some of those aches or pains or tensions that come on. Now, if you have some pregnancy related aches or pains, please let us know in the comments. We might have a video for you that I can direct you to that's specific to that. And also know that as you're preparing for birth, the postpartum aspect is so incredibly important. Now, I have a free postpartum guide. This is completely free. I highly recommend that you snag it now. Even though I did end up in my first birth having a cesarean birth, and so a lot of the movements and scar mobilization is guided towards cesarean, this postpartum guide and the early movements according to breath and reconnection in your body is just so good for anyone. So no matter what kind of birth outcome you have, I highly recommend signing up for this. It's going to give you just some education of what you can do in those first 1 to 4 weeks, which is so crucial because we usually don't get any support. So having that support in your body is going to be so crucial. So again, I just highly recommend signing up. We're going to have that linked down below and up above so you can find that link, and it's completely free just to have a postpartum resource. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.